Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on antibiotics, with 4 answer choices and explanations. Antibiotics, Clinic 1, penicillin allergy, cross-reactivity. A 42-year-old woman with bacterial pharyngitis is prescribed amoxicillin, but develops hives and shortness of breath. She needs alternative treatment. Which antibiotic is most likely cross-reactive? A. Clindamycin, B. Azithromycin, Cephalexin, D. Doxycycline. Answer C. Cephalexin. Cephalosporins have cross-reactivity 5 to 10% with penicillins due to similar beta-lactam structure. Vancomycin Red Man Syndrome. A 65-year-old man with MRSA pneumonia receives IV vancomycin. Within 15 minutes, he develops flushing and hypotension. What is the cause? IgE-mediated hypersensitivity. B. Direct histamine release. C. Cytokine storm. D. Mast cell degranulation via FCRI. Answer B. Direct histamine release. Vancomycin triggers non-IgE mast cell degranulation, causing Red Man syndrome. #3. Tetracycline photosensitivity. A 28-year-old woman with acne is prescribed doxycycline. She goes to the beach and develops severe sunburn. What is the cause? A. Direct DNA damage. B. Melanin depletion. C. Increased skin porphyrins. D. Photosensitization of skin cells. Answer D. Photosensitization of skin cells. Explanation: tetracyclines absorb UV light, causing increased sunburn risk. 4. Aminoglycosides, ototoxicity, and nephrotoxicity. A 72-year-old man with bacteremia is treated with gentamicin. He develops hearing loss and elevated creatinine. What is the mechanism? A. Mitochondrial toxicity. B. Inhibition of bacterial ribosomes. C. Direct cochlear and renal tubule toxicity. D. Free radical generation. Answer: direct cochlear and renal tubule toxicity. Explanation: aminoglycosides damage the inner ear, ototoxicity, and proximal tubules, nephrotoxicity. #5. Fluoroquinolones, tendon rupture. A 50-year-old man with pneumonia is prescribed levofloxacin. 2 weeks later, he develops Achilles tendon pain. What is the cause? A. Collagen fiber breakdown. B. Chondrocyte apoptosis. C. Inhibition of topoisomerase 4. D. Mitochondrial dysfunction. Collagen fiber breakdown. Explanation: fluoroquinolones damage collagen metabolism, increasing tendon rupture risk. 6. Clostridium difficile antibiotic-induced colitis. A 66-year-old woman is hospitalized for UTI and treated with ceftriaxone. 5 days later, she develops watery diarrhea. What is the most likely diagnosis? A. Norovirus gastroenteritis. B. Clostridium difficile colitis. C. E. coli enterotoxigenic diarrhea. D. Food poisoning. Answer: Clostridium difficile colitis. Explanation: broad-spectrum antibiotics disrupt gut flora, allowing C. difficile overgrowth. 7. Macrolides, QT prolongation. A 34-year-old woman with pneumonia receives Azithromycin. She later has syncope and QT prolongation on ECG. What is the cause? A. Bradycardia. B. Sodium channel blockade. C. Delayed potassium repolarization. D. Increased vagal tone. C. Delayed potassium repolarization. Macrolides block K-pi channels, increasing QT prolongation risk. 8. Metronidazole Disulfiram reaction. A 40-year-old man with Giardia infection is treated with metronidazole. He drinks alcohol and experiences flushing, nausea, and tachycardia. What is the mechanism? A. Increased acetaldehyde accumulation. B. Histamine release. C. Serotonin syndrome. D. CNS GABA inhibition. Answer: A. Increased acetaldehyde accumulation. Explanation: metronidazole inhibits aldehyde dehydrogenase, causing a disulfiram-like reaction with alcohol. Sulfonamides. Stevens-Johnson syndrome. A 32-year-old woman is treated with trimethoprim sulfamethoxazole for a UTI. She later develops fever, widespread skin blistering, and mucosal erosion. What is the likely diagnosis? A. Erythema multiforme. B. Toxic epidermal necrolysis. C. Stevens-Johnson syndrome. D. Drug-induced lupus. Answer C. Stevens-Johnson syndrome. Sulfonamides can cause severe hypersensitivity reactions leading to SJS. Rifampin, drug interactions. A 45-year-old man with tuberculosis is treated with rifampin. He is also on warfarin for atrial fibrillation. His INR decreases. What is the mechanism? A. Decreased vitamin K absorption. B. Cytochrome P450 induction. C. Increased warfarin clearance. D. Platelet activation. Answer B. Cytochrome P450 induction. Explanation: Rifampin induces CYP450, increasing warfarin metabolism and decreasing INR. Key takeaways for antibiotics and side effects. Penicillins and cephalosporins, cross-reactivity 5 to 10%. Vancomycin, Red Man Syndrome histamine release, not IgE. Tetracyclines, Doxycycline, photosensitivity. Aminoglycosides, Gentamicin, Ototoxicity and Nephrotoxicity. Fluoroquinolones, Levofloxacin, tendon rupture, collagen damage. Clindamycin, Cephalosporins C. difficile colitis risk. Macrolides, Azithromycin, Erythromycin, QT prolongation. Metronidazole Disulfiram reaction, no alcohol. Sulfonamides, TMP-SMX, SJS10, severe skin reaction. Rifampin CYP450 inducer lowers warfarin INR. Would you like more clinical